So
I think we're going to go ahead and get started. I'd like to thank you all for coming and attending our gourmet lunch today. I'd like to let you know that the food is provided through a gift from the foundation, and so we're thankful that we are supported. Our gourmet lunches are supported by the foundation. I'd like to let you know that this session is being recorded for those who are not able to attend. Does anybody object to the recording? Okay, well, thank you. So,
No.
Okay.
She already asked me.
So with that, I'd like to introduce our speaker, Lois Wagner. She is our ISS support specialist, and she is going to share bone marrow stem cell donation information, her personal story and journey. So thank you, Lois, for joining us.
Today I want to share with you information about a wonderful opportunity I had earlier this year. And it is a great testimony to the advances of technology, but more than that, it's a testimony to the awesome power of God. I want you to think of that as we progress. One reason I want to tell you about it is because maybe someday you can be a stem cell donor and save a life. And I'm hoping many of you will sign up in a bone marrow registry drive we're having next week. In the early days of bone marrow transplant, it was thought that the only people that could donate to another person would be close family members. But in 1979, just 33 years ago, an unrelated transplant was done on a 10-year-old girl with leukemia. And she lived another year and a half. And so what was thought as a possibility, unrelated donors, became a reality. And her parents envisioned a list of people that would be willing to donate to unrelated patients. And that was the beginning of Be the Match in 1987. Now since then, there's been a lot of growth. There are currently over 10 million members in Be the Match. It is operated by the National Marrow Donor Program, and there are over 10 million registrants currently, and it's a growing number because 54,000 more join each month. Of course, 50,000 isn't a lot, 54,000 isn't a lot compared to 10 million, but it is a growing number. This year, they're actually celebrating their 25th year and 50,000 transplants. And that sounds like a lot, and it is. But you should also know that each year in the U.S. there are 12,000 people who need bone marrow transplants, and only about half of them get them for a variety of reasons. So what is a stem cell? I use the terms bone marrow and stem cell, and I'm going to concentrate on the stem cells that are inside our bones. We have stem cells all over the place, but a stem cell, when it reproduces, it produces one of itself and something else. In the case of the bone marrow, it produces one of itself and then a blood cell. Our blood cells do not reproduce themselves. We are totally dependent on our bone marrow to make blood for us. So what happens in the case of leukemia or lymphoma? Something goes wrong in the blood, in the bone marrow, and the bone marrow, the stem cells in there, then make either deformed blood cells or blood cells in abnormal quantities. So the person gets very sick. And many times, these symptoms are controlled with chemotherapy or radiation, but sometimes that just doesn't work well. And so then the only hope for that patient is a bone marrow transplant, in which the bone marrow, or the stem cells from the bone marrow of a healthy donor are then transplanted into the bone marrow of the patient. So, where can you get these stem cells? There are 3 locations. One is the bloodstream, which is where they got my stem cells. Another is bone marrow, and the third is umbilical cord blood. This chart shows very easily how the number of bone marrow transplants have skyrocketed in the last 25 years. But it also shows an interesting thing in regards to where the sources of these stem cells come from. The blue represents bone marrow. And you can see it peaked about 1998, and ever since then, the numbers have been going down. The green is representing the peripheral blood stem cell method, which is what they used for me. And then the orange is umbilical cord blood. You can see that that is also growing. They're still doing bone marrow harvests, but only about 25% of those donations are done through an actual needle in the hip. And even those are done under anesthesia, so you don't feel a thing. So I should show you some myths that people think about when they think about bone marrow donation. And the main one is they think it's very painful, but it isn't. That's the first myth. The second myth, donors must pay expenses. I didn't pay anything. The third, donating is dangerous. It isn't. I'm alive and well. So I hope your those myths have been adequately put down because they're not true. Okay. What diseases are bone marrow transplants used for? I've listed a few here. There are other life-threatening diseases that bone marrow transplants are used for. And I should mention also that these are not treatments. A bone marrow transplant is not a treatment. It is a cure. It is a cure for these diseases. Obviously, not all are perfect. Not everybody survives. But my donation went to a 21-year-old woman with chronic myelogenous leukemia. And out of 10 CML patients who received transplants, 7 of them survived. So it's pretty high odds. So, what makes a match? Well, let me tell you, first of all, it's nothing you can do. It's nothing I can do. It was no miraculous thing that I did at all. It's totally through our genetics, a gift straight from God through our parents. And these things called human leukocyte antigen markers are what they're looking for, the matches. We call them HLA markers for short. These markers are things on our cells that tell our bodies what is foreign to us and what belongs to us. So when the donor's cells get inside the recipient, if they're HLA matched, the cells are like, oh, this is quite a lot like home. I think I like it here. And so they take up residence and keep doing the work that they were intended to do. Like I said at the very beginning, it was thought at first that just close relatives would be able to match. But that's not necessarily the case. In fact, only 30% of patients who need a transplant have a match within their own family. Wow. Which underscores the fact that there are so many possible combinations. Think of it this way. In this wheel, we have the digits 0 through 9. If you had to make combinations of these 10 digits, 2-digit combinations, how many possible combinations could you have?
A lot.
100, okay?
Oh, yeah.
From 00 to 99, okay? You can only have 100 possibilities. All right, what if we change it so that now we have 3 possibilities? How many 2-digit combinations 3-digit combinations can you have? 1,000. From 000 to 999. Okay, you can have 1,000 different combinations. Well, the thing about it is, when they do these HLA markers, they're matching on 8 or 10 possibilities, not just 3. Okay? So, if you had 10 possibilities, now let me help you a little bit, I'll put some commas in there. How many possibilities does that give you? 10 billion. If you have just the digits 0 through 9, you can put those in there in 10 billion combinations. Okay?
Wow.
Now, but look at this. Some of those 10 HLA markers can have hundreds or even possible thousands of values. Not just the 10 we used for an illustration. So what does that do for the total number of possible combinations? It's astronomical. It makes you almost feel like, how can there ever be a match? Okay? But there is. I happen to match with 7 out of 8 in my donor-recipient match. We were matched on 8 markers instead of 10, and I matched on 7 out of 8. And you might say, well, that's not a perfect match. I knew I was not perfect long before that. But it worked. okay? And they don't want to wait for a perfect match. It's a time to transplant is now. So we were not perfect, but apparently it worked. Any questions so far? Are you amazed?
Yeah.
I'm amazed. Right now, there is one person in this database of over 10 million who would match my recipient on all 8 markers. One. Now, whether that person was not in the registry at the time that she needed the transplant, or if they decided they didn't want to go through with it, or they couldn't be reached, I don't know. But I matched on 7 out of 8. Notice that this matching has nothing at all to do with blood type. It is tissue type, not blood type. So where can you join? Everybody wants to join now, right? Okay. Our own blood center will sign you up. Or you can even come to my office. I try to keep a supply of kits in my office, or I will bring the kit to your location. So it doesn't get much easier than that. Also, in the CVPH boardroom next Monday, there's going to be an actual Be the Match bone marrow registry drive from 10 to 4 that you can sign up there. Or you can go online to bethematch.org. What is involved in joining? It's very, very easy. There's a questionnaire that involves demographics, current medical condition, how to contact you, that's a big one, important one. Also questions about ethnicity, because these HLA markers tend to follow ethnic lines. So if you're from Asia, you'll probably match with somebody from Asia. If you're white, you'll probably match with somebody that's white. So they ask those kinds of questions. The other thing you do is swab the inside of your cheek 4 times. 1, 2, 3, 4. Because that's what they use to tell what your HLA type is.
Raise, please call the operator.
Okay? So it's really very simple. However, there are some things that automatically disqualify people from being in Be the Match. One is a bad heart. The reason for that is because if you would actually be required to go for an actual bone marrow harvest, there's anesthesia involved. So they don't want to take the risk of heart anesthesia. Also, cancer. If you've had cancer, you can't be a donor. Now, I think maybe some superficial skin cancers, that doesn't matter. The other one is age. You can be on the registry from the ages of 18 to 60. And after that, you're automatically taken off the list. They found that cells from younger donors tend to do better. I was 54 when I donated. So, but they might need you when you're 60 and 9 months. Who knows? You might be the only person who would match. I added another one, which is not exactly an automatic disqualifier, but it's judged on a case-by-case basis. The reason a bad back can disqualify you is because if you need to go for an actual bone marrow harvest, there's a lot of pressure exerted on the lower back for that to be done. Remember, it's under anesthesia, so you don't feel it. It is not very painful. So they will judge that on a case-by-case basis. Now I want to tell you a little bit about my experience as a donor following this outline, so you know what happened to me. It was an awesome experience. I'll start out with that. I joined Be the Match in May of 2009 at our own blood center, and after that, you just wait, and you wait. You don't know if you'll ever be chosen. You might never be chosen, but then again, you might be the only one who will match someone who needs it. And what if you hadn't joined? And then in January of this year, I got a phone call that I was a potential match for a 21-year-old woman with leukemia. CML. That's all I knew about her. That's all I know about her to this day. So after I was designated as a potential match, I didn't know if there were 5 other potential matches, 500, I didn't know. But during that period of time between January and March, I got blood work done. I went to our blood center and had my blood drawn, and they sent it away, and it was tested for infectious disease such as West Nile virus, HIV, hepatitis, and probably some other things. Also, it was tested for more specific DNA compatibility. And then on March 1, I got a call that I was the match. And then that month, between March 1 and March 30, then they got me particularly ready for the donation, which occurred on March 30. What was that preparation? Well, it was nothing in compared to what the patient went through to be prepared for a bone marrow transplant. Because what happens, their bone marrow is completely eradicated to receive the transplant.
Wow.
So anything that any of us donors would go through is as nothing compared. So I needed to go to Dartmouth Hitchcock for a physical. The reason I went to Dartmouth Hitchcock is because, as I said, Be the Match is operated by the National Marrow Donor Program, and they have hospitals and donor centers spread out all over the country that follow certain protocol, and it's very specifically spelled out how everything is done. And Dartmouth was the closest to me, so I went there, and it was a very good experience. So I went there and had a physical, and of course I signed a whole passel of consent forms. I'm sure you can understand that. And at Dartmouth, then I had other blood work, I had urinalysis, pregnancy test, EKG, chest x-ray. I think that was it.
Wow.
So I passed all those tests. And then 4 days before my donation, which was on March 30, 4 days before that, I started getting Neupogen shots. Neupogen is a drug that will stimulate your bone marrow to give up cells prematurely. And among those cells are white cells and stem cells. So if your bone marrow gives up those stem cells, then they can just take them out of your vein. Okay? So the first shot I had to have at Dartmouth because they wanted to be sure I wasn't allergic to it. And then shots 2, 3, and 4 I had done here at our cancer center. Sean Rogers got the ball rolling, and Dr. Reitsma signed the order, and Kathy Mondin drew up the drug, and Ellie Collins gave me the shots. I mean, it was just another example of how people pulled together to make this happen. The support I got was outstanding. People really wanted to see it happen. So I mentioned that the Neupogen makes you give up stem cells, but it also makes you give up white cells. My normal white cell count is 5,000, which is on the low end. But before I got my final shot, just before the donation, my white cell count had gone up to 30,000.
Whoa.
And it's this flooding of the bloodstream with these white cells that can give you flu-like symptoms. Tiredness, muscle aches and pains, bone aches, headaches, nausea, those kinds of things. And they told me, be sure to take Tylenol and Advil. As soon as you start getting this drug, make sure you start taking Tylenol or Advil to minimize the symptoms. But you know what? I didn't feel anything except a little bit of a twinge in my lower back, hips and legs, and in my sternum. Just a little twinge. I wouldn't even consider it pain. But you see, what's happening is your bone marrow is working to get rid of those cells. And so that's the reason for the bone pain. But I wouldn't call it pain. It was as nothing. Then on March 30, I went to Dartmouth again. And I went to their donor center, just their regular blood donor center. So this was my view for the day. I could see the blood donors going in and out, donating blood. And I was in a hospital bed. This was my view. There were 3 hospital beds there in a row, and between each hospital bed was an apheresis machine. It's a 2-needle process. I had a needle in each arm. My right arm was the draw arm. So the blood was coming out of this arm, going into the apheresis machine, processing, and then what was left coming back in the left arm. And then, of course, my blood was recirculating and picking up more stem cells for the trip through the machine again. So here's a close-up view. Some people don't like needles. You know what? The person that did that was so good. She put a little bit of numbing agent in first, and I watched her thread that needle in, and I did not feel a thing. I watched it. So it says nothing. Now maybe you say, well, she was really good. I don't know. This is a picture of the apheresis machine, and maybe you've seen something similar to this. But inside there, the blood is spinning at a high rate of speed. And what blood does, when you spin at a high rate of speed, it separates based on the weight of the cells. The red cells are the heaviest, so they stay on the bottom. The white cells and the stem cells and the platelets are in the next layer. They call that the buffy coat. And then above that is the plasma, or the liquid part of your blood. And what they were after was the buffy coat. Those stem cells, white cells, and platelets. They weren't really looking for platelets, but they were in the mix, so they went too. So while your blood is in there, it skims off that layer, and this thing
Code
right here
66, Emergency Care Center.
is a
Code
blood warmer.
66,
They warmed up my blood a
Emergency
little
Care
bit before it
Center.
came back to me.
Code 66,
This is a bag of
Emergency Care
anticoagulant
Center.
so that my blood wouldn't clot while it was in the machine. This is sodium chloride to prime and rinse the machine. This is the stem cells that we're collecting. Calcium chloride to replace the calcium that the anticoagulant zapped. And then this console here, there's another picture of that we'll get to in a bit. And also this little color thing down here. Those are both very unique and interesting pieces of equipment. This was the interface between the machine and the nurse to say what was happening. It told how many liters of blood had been processed, how much anticoagulant had been used, how many minutes it had been running, how fast the centrifuge was going, all those kinds of things. And it was monitored very carefully. Sometimes it would beep and they'd come running. But it was just amazing to me. And this number right here, 23,977, this was very near the end of my donation. They needed to process 24 liters of blood to get the amount of stem cells they needed. Well, obviously, I don't have 24 liters of blood. So all my blood was processed about 5.5 times to get the amount of stem cells that they needed. I got one of the shots just before the donation because they wanted to keep those stem cells popping out all through the donation. This little color chart, it doesn't show up as nicely there, but those 6 colors, you notice there's a tube running right between the two in the middle. And the nurse used this to determine if she was getting the right composition off of that blood as it came through. Because remember I said the buffy coat's in the middle. If they skim off a little too high, they get too much plasma and it waters it down. If they skim it a little bit too low, it gets too many red cells. And then those red cells don't come back to me, for me to use. So they were able to control the pump to make it match those colors so they would know that it was the right composition of cells. Something so simple to monitor something so amazing and important. And there's the smiling nurse who was my nurse that day. She was very good at it. I spent the day reading, relaxing, singing, visiting, writing, planning, resting, eating, drinking, and that's when I brought granola bars. I took granola bars that day, and people got the recipe. So that's why I wanted to bring granola bars today. Any questions?
How long was this process?
About 5.5 hours.
Oh, okay.
So basically, in round numbers, for each hour, all my blood was filtered.
Oh, okay. And if for someone who might pass out when you try to donate blood, you think that that's not an issue because they're putting it back in?
Possibly, but they tell you to hydrate very well before,
Okay.
and that helps keep your veins pumped up,
Oh, okay.
so you don't tend to faint.
Gotcha.
The other thing is, I asked one of the coordinators, said, do you recommend that people be blood donors before they try this? She said, no, doesn't matter.
Oh.
If they're anxious about it, we just give them a little Ativan and no big deal. So, if you are unsure about giving blood, don't let that hold you back. Or if you've been disqualified as a blood donor for some reason, that doesn't necessarily mean you would be disqualified for this process.
Mm-hmm.
Good question, though. Yes, ma'am.
How do they decide which way they're going to get the stem cells from you?
Good question. That is determined by the doctor of the patient. PBSC method tends to engraft faster once they're in the recipient. With actual bone marrow, they tend to have less graft versus host disease, which is kind of the opposite of rejection. It's the donor cells taking over the recipient cells, which is an amazing thing. Here's part of my support group. You may have met Ruth before. She works in our microbiology lab as a medical technologist. This is my sister, who's also a medical technologist. She flew up from the state of Kentucky to be a part of the process. And so they were kind of in their element.
Yeah, they must have loved.
And just as another example of support, the people who work in my sister's lab, they rearranged their schedules so she could come up and be with me. So there was so much support all around. It was just great. And it wasn't even a pint. That's the end of the whole process. It was about a cup and a half. For 5.5 hours to get that much. But that's all that was necessary. And that was about 2:30 in the afternoon, and by 3:30, a courier was there to hand deliver it to wherever the patient was. I don't know. It could have been in the next state, or it could have been halfway around the world. I do not know where it went. I think it wasn't far from a little clue somebody gave me, but I don't really know. And that's all I know about the person, except that at 1 month she was discharged from the hospital. The cells had engrafted, and she was recovering well from the issues normally surrounding transplant. So I should be able to get a report about 6 months post-transplant. Any questions? Yes, ma'am.
What's the follow-up for you? And the reason I ask is that I just heard a presentation on public radio about there needing to be better follow-up with kidney transplant patients. Even though it's required, I guess all sites who do the transplants don't keep good follow-up on the donors. So
Okay.
what is it Dartmouth Hitchcock who follows you as the donor?
Yes, to a certain extent. Our Blood Donor Center is affiliated with the Rhode Island Blood Center, which operates Be the Match in this vicinity. And so the Rhode Island Blood Center is following me, and also Dartmouth to an extent. But I'm glad you mentioned that, because I did want to say something about the follow-up. My platelets went down to 80 after the donation, which isn't serious, but it's low. Normally my platelets are around 240 or something like that. So I had to stay away from sharp objects and heavy lifting, because there's a chance of spleen enlargement, because all those extra cells pumped into your system and the spleen gets rid of them. So I was supposed to stay away from sharp objects and heavy lifting for a week. And then they did another CBC, and my platelets had bounced up to greater than what they were before I started. However, my white cell count was down to 2,600. And so it wasn't anything serious, but they said, well, we need another CBC in another month, which they did, and it came up to 4,600, and then the last time it was done in June was up to 4,800. So I'm within the normal range now. I think what happens is during this process, your bone marrow puts out so many white cells, and they don't have a very long life, so they die, and then the body is calling for more white cells, and the bone marrow is like, I haven't any more to give right now. Okay, because see, like I said, my white cell count went up to 30,000 before the donation. Not that it went down to 2,600 after the donation. No, after the donation, it was still up to 24,000, I think. But so they didn't take all that many white cells. What they were looking for was the stem cells, because those stem cells, once they're transfused into the patient, those stem cells find their way into their marrow. It's just like a blood transfusion. They go into the marrow, take up residence there, and begin making blood again, except this time it's for somebody else. So there's somebody else on this planet who has blood that's exactly like mine, because my DNA is making blood for her. My stem cells, which is my DNA, is making blood for her. It's amazing, isn't it, Karen?
Yeah.
Totally amazing. The stem cells, they do a blood count just before the donation to count how many stem cells you have per drop of blood. Mine was 32. And I was like, was that good, bad, what? I don't know. And they said, well, we don't like to do the PBSC donation method unless it's greater than 20. So I thought, oh, pretty good. And then they went on to say, Well, some of our young donors, their stem cell count is 100 to 200. So, wow, I was just skimming the surface. I barely made it.
How would you have felt about doing it with the hip?
I'd have been happy to. You get into this mode and you're like, anything. In fact, I had an eye condition that I was afraid was going to negate my ability to take the shots. And I went to the eye doctor. It was an emergent situation. I went to the eye doctor because the patient was going to get their bone marrow eradicated like about the next day. And so I thought, oh no, what if I can't take the shots? And then I thought, oh, hey, I could still do a bone marrow harvest. Because you see, it would bypass the shots.
Yeah.
But the problem with that is, if you do a bone marrow harvest, you're supposed to bank 2 units of your own blood prior to the bone marrow. So everything would have had to have been delayed because you can't leave a person without any bone marrow for an extended length of time. So if I had the eye condition that would have prevented me getting the shots, then I would have had to have time to give my own blood, 2 units of my own blood, and then do the actual bone marrow harvest. But I was committed to it. In fact, they have you sign a consent form for both types at the beginning, because in the event of an emergency, what if those Neupogen shots hadn't spit out my stem cells? What if my stem cell count was 5? They couldn't have done this other method. So you'd have gone for a bone marrow. And the thing is, they don't want to wait till you're in that emergency situation to get a consent signed. You're committed to it. And I'd have been happy to do it. And it's under anesthesia, and you're a little sore afterwards, but it's as nothing compared to what the patient goes through. And it saves their life. Truly amazing. As far as the recovery period, I didn't feel like I really recovered. I didn't feel bad to start with. And I really feel like it was an amazing, miraculous touch of God in my life, because it just really was as nothing. I understand some people will have more pain than I did, but it was insignificant. I wouldn't even call it pain. Does anybody here know Kathy Betts?
Yes.
Did you know she is a bone marrow survivor? Her brother donated bone marrow to her 21 years ago.
Wow.
She works here in medical records.
Yeah. Wow. Were you given any cautions during that month you were getting Neupogen, like no exposure to measles or people with colds? Were there anything do's and don'ts?
Well, that whole month, of March, the nearer it got to the 30th, I was like, I stayed about 3 feet away from anybody, and if I heard a sneeze or a cough, I felt like diving under the chairs. I was really concerned about staying well and safe. I thought about the commute I make to work and driving anywhere, and if you get an infection because if something occurs during that last, say, 2 weeks, and the patient cannot get your donation, they will die.
How soon beforehand do they remove the bone marrow out of the patient?
What was that again?
He said that they take the bone marrow out of the patient so they can put your stuff in there. How soon beforehand do they do that?
It probably depends on the patient. I don't know the specifics. It's maybe 10 to 12 days, because through chemotherapy and radiation that they destroy the bone marrow.
Oh, I see.
It varied with the patient, I would say.
My brother-in-law had multiple myeloma, and he went for bone marrow transplant. And he was over in Vermont at the Hope Lodge, and he had to stay there with his wife, and they couldn't have interaction with anybody else, and he had to stay in his room once he could. There's a point at which he can interact with everybody there, and then there was that next stage where he was completely, and he had to stay in his room.
Because he has no immune system.
Yes. I mean, his wife could be there, but she could not have contact with anybody that had been sick or whatever.
Yes. I was very aware of that. Good questions. Other questions?
So the Neupogen, you only had it before.
Yep.
You didn't do anything after, or any kind of, your body took over.
Yeah. So 4 days before it started, it was Monday, Tuesday, Wednesday, Thursday, and my donation was on Friday, and I had the last shot just before they stuck the needle in, basically. So they would keep those stem cells popping out of the bone. as the blood kept circulating.
So it works that fast.
Well, you see, I'd started 4 days ahead.
Yeah.
So it
You
was,
have a shot, you put you in it, you check their labs the next day, ooh, we skyrocket, so, yeah. Wow.
people here were amazed I didn't have bone pain. But I said, you know, when our cancer patients get Neupogen, which they do, to stimulate their bone marrow, to give up cells, that's what it's all about. I said, they're sick anyway. So, that was beneficial.
And did you have to recover at home for a while after, or no?
No, they paid for a hotel the day before, because I left 2.5 hours from Dartmouth. They paid for a hotel that night because they said, a lot of donors say, oh, I don't want to do anything but lay down, even though I've been laying down all day. So I even took a wheelchair along because I thought, how am I going to get into the hotel if I'm this exhausted? But I walked right out of the hospital and up 2 flights of stairs to the car and went to the hotel. And Irma and Ruth went and took naps. And I kept reading and making phone calls. And
You were running
so
on
then
adrenaline.
I stayed there that night, and then drove over to Fort Henry the next day. And I didn't feel bad. I didn't feel tired, and it's just not much in my nature to just sit around, I guess. So I just puttered around the yard and picked up some pine cones that had fallen over the winter, and it was hard to not do anything because I didn't feel bad. So I hope those of you who are able will sign up.
Well, what time are they here on Monday? Oh, 10 to 4.
10 to 4. And I've got a kit right here if anybody's interested. You know, bird in the hand, worth 2 in the bush. Thank you all very much.
Thank you.
Thank you.